I think of
Exactly.
therapy like being in the room. You meet them out in the park.
We will meet them out in the park. Sometimes we'll even engage in things that they enjoy doing, like playing sports, playing basketball.
Welcome to your daily health briefing. I'm Dr. Albert Tackett. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. In the previous episode, we talked about the pain people can hide behind a smile. But one of the biggest barriers to getting help is the belief that therapy is only for people who are crazy. In this conversation, Allen Elliott and I talk about the stigma, why so many people resist opening up, and how a good therapist builds trust before trying to treat anything. People are coming from a place where, oh my God, I'm going to talk to a therapist. It means I'm a crazy person. I've heard that many times. When I refer a patient, go see a therapist, they're like, I'm not crazy.
Right. Great question. I think we use different methods. Our therapist, which I think makes Allen unique, we're more unconventional with therapy when necessary, especially with young Black men. If you sit a young guy down in an office and you just start asking him questions right from the top, there could be some walls there that he's going to put up. So sometimes we will meet with clients more outside if the weather's nice. We will engage
outside the
outside of the office.
Okay.
Like in a park.
That's innovative. I think of therapy like being in the room. You meet them out in the park.
We will meet them out in the park. Sometimes we'll even engage in things that they enjoy doing, like playing sports, playing basketball. We want to find out what their interests are. And then once we can find out what their interests are, those are the things that we talk about even before we get into all of the treatment goals and what are some of the issues that you're having. Sometimes that can take several sessions before we feel comfortable moving forward with that. But we found that to be way more effective than your traditional sitting down. And don't get me wrong, sometimes depending on the patient, sitting down in an office and just doing the traditional therapy works. But we try to cater to our folks. And in my experience, I've been doing this for 25 years, with young Black men, or even Black men in general, they are more responsive to the more unconventional ways of therapy. And then once the trust is built, then they don't mind coming in. They don't mind sitting down and you asking them questions and being vulnerable and all of those things, because now the trust has been built. The rapport has been built. Such a close relationship with patient and therapist. So it's very, very close bond, a very, very close relationship. And we really emphasize on building that first before we move into the more of the things that we have to deal with in terms of the actual diagnosis or the illness.
So what would you say to the patient who tells me when I refer them to a therapist, they're like, Doc, I'm not crazy. I don't think I'm at that level. What does that mean?
I think that's a good question, and I think the retort should be, well, maybe you're not crazy. That's what we want to find out. Okay, maybe, and I wouldn't even use the word crazy. If they use the word crazy, I would probably use a different word. I would say, you may have some emotional issues that are going on. You may have some feelings inside that are going on that are making life uncomfortable for you to function in everyday life, to function with people that you care about. Are you seeing some disruptions in your relationships? Are you seeing disruptions in your own life? Are you able to get out of bed? Are you motivated? Okay, no, I'm not. Okay, so let's explore what it is. It doesn't mean you're crazy.
So where does that notion come, though, where people associate having depression or anxiety with being crazy? It's always puzzled me. I've been trying to find the origin of that connection.
I don't know where the origin is, but I just know it's part of the stigma that's gone along with mental health for many, 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 many decades. Again, I think that now it's improving. I think COVID really if a lot of bad things happened with COVID, but I think one positive thing that happened with COVID was that mental health became more into the forefront, because so many people now they had issues from COVID, or they already had issues before, but it just was arising more, and there's been more emphasis on it. So I don't know where it comes from, but what I know, it's part of the stigma, and it's the stigma that myself, my colleagues at Allen Elliott, and I know even you're passionate about this, we're trying to debunk that stigma.
Okay. So when I found out that, what happened to Mark after he shot himself, it shook me, and I kept thinking, how did I miss it? Like, this is a guy I saw all the time,
Yes.
every 3 months in the office.
Yes.
So as a therapist, do you ever feel that way? Like you're helping everyone else, but you still wonder if you're missing something?
Absolutely. Absolutely. I think that's always I don't want to call it a fear, but that's a thought in the back of, I think, every therapist's mind is, am I catching everything? Am I making this person feel comfortable enough to share this with me? And I think that goes back to what I was saying earlier. That's why we emphasize the rapport and trust piece before anything else, because Mark obviously did not feel like there was anyone that would understand him without being judgmental. I mean, I'm not inside Mark's mind. I don't know exactly why he did what he did, but that could be one of the reasons. Sometimes when folks go to that extreme, they feel like people are better off without them. Sometimes it's an act of love. It's distorted.
It's an act of love.
It could be an act of love because my loved ones will be better off without me. That's the distortion. That's what the mental illness causes. Mental illness causes distortions in thinking and cognition, and that can result in behavior.
So you're saying there's some people who commit suicide with the idea that their loved ones would actually be better off without them.
Absolutely.
Their presence makes things worse.
Absolutely.
I'll just take myself out.
Absolutely. That's one of the biggest reasons I've seen in my career as when folks do that. They will rationalize and start to think that they're better off without.
Wow.
And it's, of course, it's part of the mental illness that they're dealing with in terms of their depression, in terms of their anxiety. And these things can be treated. Sometimes it's difficult to spot it because, again, with men and Black men, we hide it. We think it's our job to hide it because it's our job to be strong all the time. But the reality is we're human just like everybody else. And in a lot of studies have shown that we're under more pressure than most folks. So theoretically, you would think that we would even more susceptible to depression. And I think you mentioned that earlier. We are.
Yeah.
It's sort of the elephant in the room. I'm a brother. I'm good. I don't need anything. It's the elephant in the room. And we know that's not true. And so in dealing with folks, we try to let folks know that this is just an illness or a problem like any other part of the body.
Just like high blood pressure.
Blood pressure, diabetes, same thing. The brain is actually, I think, the second largest, or you correct me, Doc, it's the second largest organ before the skin. Or is it the largest organ? I don't know. What I'm saying, it's the largest organ of the body, and it controls everything.
It is the computer of the body.
Yes.
Yes. So it does control everything.
If there is one message to take from this episode, it is this one. Needing therapy does not mean you are broken, weak, or crazy. It means there may be something inside you that deserves attention, care, and guidance. And sometimes the first step is simply finding someone you can trust enough to start talking. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Tacken, your physician ally, high-level science, human-level care.
I will see you at the next briefing, or I will see you in the clinic.